Gentlemen, thank you so much for joining us. I'm sure everyone here in the room has heard in some capacity of Sisu Clinics and their huge success. James, I'll come to you first. Just tell us a little bit about the clinics and how it all started.
So, thanks for having us anyway.
Great to have you.
Start with. So, I suppose Sisu Clinic started back in 2018, but the genesis of this business started back in 2014. It was a part-time business started by myself and my brother Brian. It was called Visage Clinic at the time. Maybe some of the original patients might still remember that name. In 2018, we took on some investment. Myself and Brian left hospital medicine, and Pat Phelan joined us as a co-founder and a CEO, and we started to expand the clinics. Kind of pushed on through that and through COVID. We're now at 23 clinics, so 15 in Ireland, 5 in the US, and 3 in London.
That is such a success.
Every time I look at your Instagram feed, there's a new clinic popped up in Miami or New York or somewhere, James. Yes. It's a great Irish success story too, with you and Brian at the helm. Sam, can I ask you about treatments? Because, you know, obviously in Sisu you offer all different types of treatments. What are the newest treatments that people are going for these days?
Yeah, well, of course. Well, first of all, thanks a million for having us again. I suppose we get so many different patients from all different ages, all different backgrounds. Some new, very cool treatments that are happening at the moment, Sculptra and Polynucleotides. I don't know if you've heard of them.
Tell us about Sculptra first.
So Sculptra is this, sorry for not using very scientific words, but it's a very cool treatment. I think it's really popular at the moment. So basically, Sculptra is a powder that we get into the clinic, and it's really used for patients who have volume loss in their face. So as we get older, unfortunately, one of the side effects of aging is we kind of lose a bit of volume in our face. Through kind of tricking the body's immune system and tricking the cells, we can inject this powder into this liquid, once we mix it with some liquid, into the skin, and it tricks our body into producing kind of new collagen and really plumping up the face and adding volume where patients would typically lose it as they get older.
And it's not probably as invasive as maybe a filler, is it, James?
No, it's not as invasive as a filler. It's put in typically with a cannula. It's a liquid. It very gradually takes effect. You do about a vial per decade or a treatment per decade. So if you're 50, it's 5 treatments. They're done about a month apart. You see the final results about 3 months after the last treatment, and it lasts about 3 years.
And I suppose that's, as you said, it's not something that's kind of newfangled or made up. It's very much been tried and tested, which I suppose gives even more kind of confidence in it before people get it.
Yeah, and there's kind of a move away from that overfilled look, and people want a more natural look now.
Sam, there's a lot of talk now, James is alluding to it there, of a more natural look, and then you are also finding more natural based products like polynucleotides, and people will know this if you know it's kind of dubbed the salmon sperm facial. Tell us about that.
Yeah, well, polynucleotides are really up and coming at the moment, and you hit the nail on the head there. Salmon sperm. The amount of patients that come into me into the clinic and go, "Is it true? Is it made out of salmon sperm? Is it natural?" And yeah, it's an amazing innovation at the moment. It's fragments of DNA that again are injected into strategic places into the skin. We often use a cannula as well, and it's really good for skin discoloration, hydration, and just general skin health.
And I suppose a lot of people who maybe have yet to get any treatment, they might be apprehensive about going into clinics, but I imagine, you know, people can come in, have a chat, they don't have to agree to anything straight away. It's a nice environment in the Sisu Clinic, isn't it, to come in, have a chat, and just an initial kind of discussion, really.
Absolutely. So you can go onto the Sisu website or even come up to our stand at the end today, and we can book you in for a free consultation, and that's just a chat with a doctor, and we can have a look together at whatever is bothering you about your face, or if you have any queries about your face, and we can help, as James said, get the best version of yourself.
And I think the important thing to remember is nobody needs any of these treatments. There's nothing we do that's essential to your physical health. You know, it's not going to deteriorate if you don't get Sculptra, but rather if there's something that bothers you and it's amenable to a treatment and we can match it with it and you want to do something about it, great. If it doesn't bother you, it doesn't bother us. And I think that's the way it should be, you know.
That's a lovely attitude, actually, James, to have, because I think as we move kind of through the modern world, we all have to be something that we think we should be rather than who we are sometimes. So if it's something that you want, it's not something that you necessarily need. But you know what? When people have certain treatments, it does lift them.
It helps people's confidence, I think, and sometimes you'll find, and it always surprises me, doing this 13 years, that the things that you think are maybe obvious when you're looking at somebody don't bother them at all, and then there's something really small that's probably almost imperceptible to somebody else But, you know, you change that or fix that for them and it makes a huge difference to them.
James mentioning there, you know, you might look at somebody, you might notice something. Maybe they have like a bump in their nose, or tell us about those kind of treatments that you can use fillers in a different way to almost, I'm not saying re-sculpt your face, but to fix something that are maybe a quirky thing that you don't like.
With certain people who are suitable for it, you can do a non-surgical rhinoplasty, and it's the biggest thing there is the consultation, because often people will come looking for that and they're not suitable for it. The criteria are quite narrow, in which case we refer them to a plastic surgery colleague. But for patients who maybe have a dip there in the centre of the nose or here, you can put filler in to make the nose look straighter. Doesn't tend to change how you look straight on, but it makes it straighter and creates the illusion of it being smaller in side profile. But I think the thing with that though is the consultation is key and patient selection is key, and we're very strict on the criteria.
Dr. James, Dr. Sam, thank you so much for joining
Thanks
us.
a million.
Thank you so much. And of course, the Sisu stand is outside, and the guys will answer your questions there.
Yeah,
Thanks
come and
a
have a
lot.
chat with us after. Thank
There's
you so
no
much,
such
guys.
thing as a stupid question. If anyone wants to know anything, they can come out to you. Lads, thank you so much. A round of applause, please, for the gentleman from the Sisu Clinic. Thank you.